The coroner has restarted COVID-19 testing again in St. Jamestown. Testing will be carried out by Sherbourne Health and will take place at the corner 200 Wellesley Street East.
The pop-up clinic started last year in October of 2020. We did about 8 weeks at that time and then took a little bit of a break over the holidays, and then now we're back for another 10 to 12 weeks. The clinic is run every week. We are here on Tuesdays from 1 to 5 and then on Fridays from 9 to 1. Our hope is to do community testing, which means that we're doing neighborhood testing, and we would prefer if folks from St. Jamestown are the ones who come here to get tested. However, if you're not from the area and you do come here to get tested, we don't turn anyone away and we will still do the test for you. In 2021, we've noticed a drastic increase in our positivity rate. In the last 2 weeks, we're seeing about 11 to 12% positivity rate, which is higher than the general population. But definitely the density of the population, I think we also see a lot of vulnerable and marginalized individuals here as well. People may be working 2 jobs, they may be living in close quarters, so there's more exposure. So I think there are a multitude of reasons we're seeing the higher positivity rate.
The testing is free of charge, doesn't require an appointment, and will last from January through March.
So when they come in, we have an assessment tool where we assess patients for symptoms. We also assess them for any exposure that they may have had, and then we also assess them to see if they fall under one of the marginalized individual list, and that's how they get started in terms of the testing. We see a wide range, so we definitely see a lot of children. We see a lot of newcomers and refugees. We see a lot of seniors as well. We also see a lot of marginally housed individuals as well. So I think seniors may be the people that we were really trying to reach, because those are the people that find it hard to go to a community assessment center, a COVID assessment center, or you may need an appointment for those, and we don't actually need appointments. So it's easier for them to access us because they might not be able to navigate a computer.
The coroner outreaches to people and follows up with them in case their results came positive or they needed support.
Now, during the COVID-19 testing, I am working with the community residents whom we recruited as our COVID-19 promoters to do the outreach about the testing. So the COVID-19 promoters were trained by the public health about the safety and protocols and information about the COVID-19, and they involve on different activities to conduct the outreach. So one is in the St. Jamestown neighborhood. We do have our information board in all 19 high-rise buildings. So we update the board time to time with the information. So those were shared through those information boards, and we also translated into 7 different languages which are highly spoken in the St. Jamestown neighborhood.
Health Access St. Jamestown has been one of the key players in providing support pre- and post-COVID-19 testing clinics. During the testing day, Health Access staff will do brief assessment on individual. In this assessment, if someone doesn't have a family doctor, we will ask whether they would like to get information on what the family doctors that are available in the neighborhood, or other support services like connecting them to a family doctor. So if they say yes, what we do is we follow up with them later and providing them information about family doctors, and also if they would like us to help with navigating it, we also help them connecting them with clinics like primary healthcare support services. And with wraparound services, what we do is with the consent of individual who tested positive, we will reach out to them to provide support services. For example, during the time that they are staying home to isolate and prevent spreading the virus, they also are some kind of support, like grocery support services, like they might need, like 2 weeks time when they're staying home, the groceries. So either they can request from us gift card support, a grocery gift card support, or if they can't, or they would like to have some groceries at home, so we will drop off those groceries to their homes. And also other thing is like a meal program, which is like prepared meal. If they can't make meals during that time, we also providing them meals to their homes. And also the other thing is like we also provide information which is important to most of them, like voluntary isolation center, which is if somebody is living in a shared place that they need to isolate from the other people. So there is a voluntary isolation centers run by public health, and what we do is we give them information and connecting them with that support services. And also there are other services like financial support, CRB, CRSP. So if we also provide that information to them, if someone say that help that application, we will help them over the phone, like walk through them how to apply for these services.
We've definitely seen a very positive response from the community. I know for the few weeks that we weren't doing the testing in December compared to when we came back, there were a lot of people who were like, oh, we're so glad that you're back. We're going to tell everyone. Can we get flyers? We're going to put them in like the laundry room of our building. So I think people have been very appreciative. And, again, it's about accessibility, making sure the neighborhood has accessibility to get tested when they need to. We're seeing more people than we were before. And again, I think these numbers are just going to continue to rise until the number of COVID cases start to decline, which at this point we don't know when that's going to happen.
Yeah. They really appreciate what we do because it's at their door. It's very accessible. They don't need to go somewhere, so they don't need to take transit to go and get the test.
In terms of who should get tested, so anyone who has any symptoms, so cough, sore throat, fever, chills, nausea, vomiting, muscle pain, difficulty swallowing, they should definitely get tested. Anyone who's had an exposure to anyone with COVID-19. So this could be somebody informs you that they've had COVID-19. It could be from the app, like the COVID-19 app. It could be from public health saying that there's been an outbreak. So all those individuals should get tested.
Please do not forget to like, comment, and share to our channel. Follow us on all our social media platforms. And for more information, please check out our website.